vecindario todo es fiesta y alegría, porque ya el boricua tiene la cerveza que quería.
Hay baile en el vecindario, todo es fiesta y alegría, porque ya el boricua tiene lo que el boricua quería.
Dame una boricua fría para celebrar la ocasión, una cerveza boricua, boricua de corazón. Bailan mi viejo y mi vieja y cantan esta canción con la gente de mi barrio que está celebrando con una cerveza boricua, boricua de corazón. Una cerveza boricua, boricua de corazón. Una cerveza boricua, boricua de corazón. Una cerveza boricua, boricua de corazón.
Welcome back. I'm Jose Miranda. This is Hispanic Speak Out TV, brought to you each week on Bright House Channel 49, starting at 9 o'clock, actually. We have 3 programs, EDU TV, we have ourselves, and we have Latino Role Models, which follows. So stay tuned for some great shows. Today we're going to talk about, we're talking about politics and things, but we're also going to talk about something special and unique that pertains to us, all of us. And we're talking about health and healthcare and issues that affect us, Latinos and others. So tonight I'm being joined by Amber Shane, who's a doctor, a surgeon, a very unique individual, and you'll be surprised at her spunkiness as well. And on my left, unfortunately, I have to introduce Danny Ramos, who's the executive producer of our show and who has been here since the beginning of time. So
that's true.
That's true, right? So what's up, man? How are you?
Well, I'm doing good. I was here, when black and white TV,
That's
when they started, it was all tubes, and all that kind of stuff. I remember having the tubes on the set, So I've been here for a while.
Thank you.
Thank you.
I really
Thank you for
appreciate
having
it.
me today.
Yeah, good. So you want to go with the first one, or do I go with the first one?
Full disclosure, Amber is also my doctor.
Perfect.
So we don't have unnecessary bias, because I'm going to attack her anyway.
Is that your mental doctor?
Mental health.
Mental health.
We try to give a little of everything.
A little bit of everything. Listen, controversy is always with the Obamacare thing, or the. A lot of people think, or under the impression, in the Hispanic community and the community in general, that when you have Obamacare, you don't have to pay anything.
Affordable Care Act.
Yeah, the Affordable Care Act. And that covers, when you go into the doctor, it's like, okay, I'm covered for everything, I'm not going to pay anything.
Right.
Is that true?
No, actually that's one of the problems that people have been having. They've been signing up for the Affordable Care Act issues, and they pay their large monthly amount that they have to pay, whatever's determined by whatever plan that they pick. Sometimes they pick a plan that has a little lower amount that they pay each month, but then when they go to the doctors, they have a deductible, which means they have to pay a certain amount until they meet that deductible. So when they do go to the doctors, then some of those expenses are going to be not necessarily out of pocket, but they're going towards their deductibles. And until they meet those deductibles, they're going to have to continue to pay
Okay,
it.
why don't we, because again, there is a lot of people who don't understand the medical thing. What is a deductible?
So a deductible is, let's say you have one on your auto policy, your homeowner's policy, if you're a homeowner or a vehicle owner. Let's say it's $1,000. Until you reach $1,000 and pay $1,000 of your own money, they do not cover everything.
So if you have a deductible of $1,000, you're responsible for the first $1,000.
Correct.
And then the insurance kicks in.
Correct.
So Obamacare has deductibles.
Yes, correct.
Okay.
They do. Depending, and I don't know all the details on what policy has what, but some of the policies have a higher deductible with a lower out-of-pocket monthly, and some have a higher out-of-pocket monthly, and then they have a lower deductible.
Right.
So people who think they're not very sick or ill very often, a lot of times will choose the lower monthly payment for the higher deductible. And then some who know that they have a lot of medications and have a lot of illnesses will take the one that's higher each month, because they're going to cover more in the long run for them.
Okay, but they do have to pay.
But they do have to pay.
Okay, when we were talking in the conference room, I asked you a question, and I'm going to ask it for the audience. when you go in, you're providing various services, right?
Yeah.
So you may have a separate charge for each type of service, and each type of service may have a different deductible.
Correct, and this is true with all insurances nowadays too. So not just talking about the Affordable Care Act, Obamacare type of insurance. If you have basic Blue Cross, Aetna, Cignas, all those insurances, most of them have separate deductibles for separate types of services. They divide out the types of services. For example, you come into the office, that's considered an office visit for your treatment there. But if you end up needing to go to surgery, a lot of them have a separate surgical deductible. If you have to go to the ER for treatment, they may have a separate ER deductible for going into the ER. If you break your ankle and I have to give you a fracture boot, then they may have what's called a durable medical equipment deductible separately as well for your boots, your braces, your things, your splints that may help you.
So
you're going to have separate ones.
So different service categories or different equipment have deductibles. So you
Correct.
can walk into the office thinking that you're going to have one deductible and you'll end up with 3 or 4 different fees that you have to pay depending on what you need.
Correct, but most insurances overall then have another deductible that's called max out of pocket. So among all those things totaled together, once you get to something, they cover everything. It's called a max out of pocket as well. So they may have $500 on surgery, $500 on office, but then you have a max out of pocket of $2,000 total, and then they cover everything, every penny after that.
Okay. How has the Affordable Care Act or Obamacare affected physicians, doctors? In other words, I'd like to know, are doctors, you know, there was talk about doctors saying, I don't want any part of this, and they go into a field that's totally different or related to medical, but not specifically to get involved in as a medical provider. How has it affected you? How has it affected other doctors?
So that's an interesting question, because it's affected in so many different ways. So the first way it's affected is overall the reimbursement that the Affordable Care Act provides to a doctor or to a practice is significantly low in the medical world. So in order to keep up the same expenses, keep the practice open, keep everything going, people have to either see more patients or take in less Obamacare type patients at the same time. So you may have a longer wait to see a doctor, as far as it may be 2 weeks to a month before you can get in as a new patient if you have an issue. Or doctors have to see more patients in one day in order to make that up, so it sometimes makes for a longer wait time in your doctor's offices. Some doctors are leaving insurances altogether and starting what they call concierge medicine, which you pay like a country club deductible. You pay $2,000 for the year and you have open access to the doctor all year long, and they don't go through insurance whatsoever at all. Now, some people carry insurance for hospital admissions and major accidents, but some people are now going to doctors with this concierge medicine.
So you're going back to the doctor visiting your house?
Going back to the doctor visiting your house, or just being phone call access, email access, no waits, spending more time with you in the office with that type of medicine. So as far as going back to affecting it that way, and the good note, the Affordable Care Act and Obamacare is giving medical access to some people who never had that option in the past.
Is there such thing as no deductible? Is there in Obamacare, is there such thing that a person is at a low income level and they pay nothing?
Well, yes, there is still Medicaid. There's always been Medicare and Medicaid. Medicare is for the people over 65 who have been citizens of the United States and contributing to the Medicare system over the years. Then they retire and they qualify for Medicare once they hit 65. Now, Medicaid is what the government has had around for years, and that is for a very, very low income set of people. So the problem always has been over the years is the very low income have been able to qualify for Medicaid, and then the people who make a lower income but not low enough to qualify for Medicaid yet can't afford those Cigna or Aetna plans, or work for a company that don't offer insurances. There's some small businesses that don't even offer insurances. So to get one on your own in the past through Blue Cross was just astronomical. So the Affordable Care Act is kind of been working for the in-between type of person, not the poverty, which the Medicaid has been more for the very low income, but not the higher income. So it's kind of bridged that gap in the middle a little bit. But they still have to pay, because most people will have a job and they have have to pay out that. So it's really helped access care for a lot of people who didn't have it before.
To be fair, the Affordable Care Act is not it's not the first programs that pay co-pays. Copays have always been part
been
of
there.
it. Okay, so before someone says Obamacare this or Affordable Care
Unless
Act
you
that,
have unless you have gap insurance.
well, yeah, that's
Because you
something
can,
different. That's-
I have insurance, I have an additional insurance with Colonial Penn, and I don't pay anything when I go.
Right.
So
right.
I pay an extra $156 a month, and regardless, I always get a zero on the bill.
Well, the fact is that you want to bash Obamacare, so I just want to make sure that.
No, I don't want to. I don't want to bash Obamacare. I'm just giving the variables.
It's-
That's
it's
all.
just-
I mean, I want her to give the variables.
It's been around for a very long time.
I
What,
mean,
This is
Obamacare?
about Affordable Care Act. Deductibles have been around for a very long time.
They have been around forever.
Okay, and the Affordable Care Act will be on, or some form of it will be on forever.
Yeah.
We need to address the situation of people that are underserved, because as I was explaining to you, I believe that the underserved will eventually harm the people that are actually doing better physically, as opposed to just totally ignoring it. What do you think of it?
Oh, absolutely. If you have people, it's an overall tax to the healthcare system when you have people who don't have health insurance and then wait until their disease process. For example, let's take diabetes, which is a very, very common Latin issue and problem. There's a high prevalence of diabetes and a high prevalence of not being properly taken care of. So let's say you wait and you're not taking diabetic medications and you wait till things get out of control. I take emergency room call at Florida Hospital East Orlando. Every time I'm on call, and I think we had this conversation, I have to amputate somebody's toe, foot, due to diabetes from them not taking care of themselves. They're not seeing doctors, whether they have insurance or not. For some reason, they're not taking care of themselves. They're going into the emergency room and they're coming in when it's too late, when the diabetes is out of control, when infection's taken over. So the cost of them, if they don't have insurance, or even if they do have insurance, to the healthcare system, of them landing in the emergency room, being admitted for 1 to 2 weeks into the hospital, IV antibiotics, surgeries, all those things, if that had been just prevented with preventative care, that's taxing our healthcare system and the taxpayers just by them not having insurance and them not seeking treatment. So overall, the goal is people having insurance should, in the long run, keep the healthcare problems down if they're taking care of themselves and doing their checkups and visits.
What about people who just don't have insurance? How do they process when they walk into an office or something like that?
So
do you serve them, or do doctors' offices serve them if they walk in and say, look, I don't have insurance? Or do you send them to the emergency room?
So the emergency room is where patients who have a problem can get medical treatment. And they do not have to pay up front.
But they do have to pay.
Well, they usually work something out. So I would say the majority of those times, they have what's called financial services through the hospital. And a lot of these people that don't have insurance just don't know how to get the Medicaid. There is a huge application process for this. So let's say they go into the emergency room, they don't have insurance. They will get registered, and the financial services people will automatically help them start the process of getting Medicaid. If they qualify, they'll help them with the paperwork and everything.
Amber, tell us how to reach you. Your office or
Sure.
consultation?
So I do all types of foot and ankle surgery, general podiatry checkups, care, and I work for Orlando Foot and Ankle Clinic, and our number is 407-423-1234.
Thank you.
Thank
you
you.
very much for joining us.
Thank you.
Appreciate it.
It's a pleasure. Thank you for all the information.
Thank
It's
you.
been helpful.
Thanks. Have a great day.
Close?
I'm Jose Miranda. This has been Hispanic Speak Out. We'll see you again next week.
My name is Nilmarie Zapata, and I am a Latina role model because I believe that you can overcome any circumstances that come in your way and be the best version of yourself.
Hello, I'm Sandra Rivera, and I'm a Latina role model. Whatever your struggles are in life, whatever you don't have or don't have access to, don't use that as an excuse for not pursuing your dreams and moving forward. Get out of your own way and get out of your comfort zone, and you will be amazed at the growth that you will experience.
Hi, I'm your host, Jose Miranda. This is Hispanic Speak Out TV, brought to you each week on Bright House Channel 49. We have 3 programs. Of course, EDU TV, which precedes us, and after us is Latino Role Model. So please stay tuned for those shows. Also, in the future, we're going to be doing cooking shows, so please stay tuned for those notices of when it's coming on, okay? We talk politics here because we talk education, we talk a lot of stuff. We have panel discussions here with some great participants that we talk about everything. We're going to talk tonight a little bit about abortion and the Planned Parenthood, and with me for that is the one and only and the expert in that field, Anna Escalante, and she is a spokesperson for Planned Parenthood. Hi, Anna. How are you?
Good, Jose. As always, thank you for having me.
Thank you for being here. Listen, Planned Parenthood has a lot of things going on, okay? And before we get to, I would say, with some positive things about, let's talk about some of the negative things that are out there. There is still a big contingent of people who are concerned about you guys selling body parts like you sell hamburger. Okay, so what's up with that? Is that real, not real?
Not true, it is false. And I would also say that I think despite the latest smear campaign against Planned Parenthood, we have continued to see a broad scale of support across the country with 10 national polls all showing strong favorability towards Planned Parenthood.
We had those undercover kind of tapes where you had people seemingly from your organization speaking literally about selling parts. Is that a falsehood? Does it happen?
It does not happen, and I think the greater public already knows that those videos were heavily edited and heavily doctored, and forensic evidence also shows that. And our national president, Cecile Richards, has already apologized for the tone of the doctor's voice, because obviously the tone of the first video did not reflect the compassionate work that we do. And so with those points made, it's obvious that these videos were well orchestrated. This is part of an organization that planned to do this over 3 years, build trust with Planned Parenthood, basically to do whatever they could to attack us and our work and our brand. And ultimately, the public isn't buying it. Like I said, 10 national polls that showcase strong support for Planned Parenthood, and we continue to enjoy 4 million supporters across this world.
Some of our contributors to this station have pointed out to me to ask you, basically, there was an article that was put out by a young man who is a sports person, young man, African American, who wrote an essay basically in essence condemning the fact, or being alarmed by the fact, that more African American women have abortions than they are births. So as a Planned Parenthood, should you be more concerned about not necessarily providing the ends as opposed to providing the means to continue that birth?
Well, I think you've hit on a very important issue of healthcare disparities in our communities. And what I will say is I can't speak to that specific study because I don't know where it's rooted in and what the facts are. But what I do know is that we continue to see healthcare disparities across the country where communities of color are most impacted. And at Planned Parenthood, more than 90% of what we do is preventative services. I'm a Planned Parenthood patient myself. I came to Planned Parenthood back in 2008 access to contraception so I could prevent unintended pregnancies and make decisions that were for my health and my well-being. And that's what we need to do, right? We need to expand access. We need to talk about prevention. We need to teach abstinence as the most effective form to prevent pregnancies and STIs, and also realize that our young people need access to greater information so they can be healthy and strong. And so this really is about ensuring that all of our families, no matter what zip code you're born in, no matter what the color of your skin is, no matter what your economic background is, that you will have access to healthcare and access to the information you need to live a healthy, long, and happy life.
So you're saying when someone comes in with pregnancy or I want to say promiscuous behavior, just natural behavior, the first thing you do is tell them they should not be here seeking abortion?
Well, every situation is so different, so I don't want to speculate on an isolated example. I mean, even for those who are seeking access to abortion, every situation is so different, right? You have some folks that really want this pregnancy to be carried to term but can't for medical reasons. You have folks that, from all walks of life, and we respect every decision, but ultimately what it comes down to is when a patient seeks access to care from us, no matter what the service is, we provide them a non-judgmental and compassionate place of care. And when it comes to decisions around a pregnancy, Planned Parenthood provides all people with their options, whether it's to choose adoption, end a pregnancy, or raise a child child, we are there with the patient to make sure they know what their options are, they have appropriate referrals of trusted resources, and that they will be treated with respect and dignity no matter what their decision is. But again, I want to stress that more 90% of what the work that we do is prevention. So majority of our patients coming to seek services are the folks coming for birth control, STI testing, pap smears. We do cervical cancer screenings, breast cancer screenings. We also do vasectomies. And so majority of our services are in the realm of prevention.
Okay. Most Americans, I guess, in the numbers that they poll and stuff, would go along with the idea of abortion, okay? They will Planned Parenthood that has been successful and yada, yada, yada. But most politicians, and I would say perhaps one party over the other, would indicate that the system is out of control, that you guys are out of control. You claim that the monies used specifically for abortion come from a private donorship base, and everything else comes from the government. So how, and I spoke to you briefly about this off air, how do you put this to face when all the money goes into one kitty? How do you know which money is meant for one thing or money meant for something else?
Well, first of all, I think that it's obvious that Planned Parenthood doesn't receive a great deal of federal funding to begin with. The money that we do receive comes in the shape of Medicaid reimbursement, which is via services rendered. So when a Medicaid patient comes and seek access to care from us, then we charge their Medicaid much like any other provider would. And in Florida, we actually lose money on Medicaid because reimbursement rate is so low that we actually have to fundraise to make the difference. Now, when it comes to this dynamic of federal funding being sent to organization and how is that structured out into the greater organization, it's important to know that the Hyde Amendment prohibits federal funding from being used to cover the cost of abortion, except in very rare cases of incest and rape. And so with that said, there are these laws in place that prevent that federal funding from being used in those ways. And we are aware of that, and we work very hard to ensure that, whatever type of resources we're providing, we're doing it to the fullest legal and ethical standards and guidelines. And so we are audited, we're accredited, we're a trusted healthcare organization. 1 in 5 American women have been to a Planned Parenthood health center at one point in their life, and there's a reason for that. So your numbers are still very high. You don't have a lull period. Well, what I will say is that, the healthcare landscape is changing, right? And actually we've merged. And so on July 1, 3 Planned Parenthood entities, Planned Parenthood Greater Orlando, Planned Parenthood Collier County, and Planned Parenthood Southwest and Central Florida came together to form one Planned Parenthood across 22 counties. And that is a trend happening in healthcare across the country, because as the Affordable Care Act moves forward, organizations have to transition to electronic health records. That is an expense for any nonprofit, especially for ours. We have to hire some really smart administrative team that can, focus on taking insurance. We accept private insurance just like any other healthcare organization, but there is a lot of work that is involved with that. And so, we want to make sure that we can always see as many patients as possible. And I do want to stress that we never say no to anyone. And so we continue to keep low cost pricing. And also if there's a patient that is facing a financial burden to access a service, then we will work with them one-on-one to ensure that they can receive that service.
Okay, it appears that the Republican Party is now slightly tired of chasing Hillary and her storyline, whether it's her emails, et cetera, and now have decided to turn their attention back to Planned Parenthood, their other pet peeve. So they want to cut you out, period, and maybe you could do with less people do the same thing. Is that possible?
I'm sorry, do it less people?
In other words, let's say you have a staff of 10. And if I cut your budget down in half, wouldn't that help you out?
Again, that's very misleading, because the federal funding isn't paying for staff. The federal funding is paying for services. So, like I said, for Medicaid, for example, if a patient has a Medicaid HMO, which majority of Floridians will have that type of Medicaid if they even have Medicaid, and they come to our health center, and when they receive a service, it is the cost of the service, the cost of the insertion device, for example, that's what's reimbursed. And so
nothing for staff.
we have to raise money in order to operate. And our new budget after we've merged is $16 million. We have to raise $4 million in order to ensure that we can continue to provide a full range of reproductive health care services through our 12 health centers, and that is through private donations. Now the dynamic of staff is impacted with grants. So for example, one of our federal grants had already sunsetted, it already ended, and we had educators that were on staff through that grant. But because the grant ended, we don't have those staff anymore. So I mean, to answer your question, yes, we are making those decisions based on the source of funding that we have. We are just like any other nonprofit when it comes to ensuring that we can provide the services that fulfill our mission.
Now, isn't the state providing already for women's health? And especially the Republican Party is going way out of their way to help women in all kinds of phases by providing monies and stuff like that. And of course we have, in this state, for example, they're trying to put in a new, something different than Obamacare, the Affordable Care Act. They're putting in something else that would just as easily help women.
In this point, Florida, there continues to be a coverage gap. There are nearly 800,000 Floridians who don't have access to care. They don't have any type of insurance. Now, Florida has been the most successful in the Affordable Care Act enrollment. We've had over 1 million Floridians enroll in the Affordable Care Act, with still many more that need it. Florida ranks 49th in the country for the number of children who have insurance. So we have a huge population of children who are uninsured. And I'm also sad to announce that the Florida Department of Health is moving out of prenatal care. And right now, only one county, Brevard County, provides women with prenatal care throughout their pregnancy experience. And so
Planned Parenthood would step in and take care of that.
We have some serious issues in this state when it comes to women's health. Women's health is at risk, and Planned Parenthood has 23 health centers across the state, and we are honored to play a role as a private solution, as a nonprofit organization, to ensure that people can have the ability to control their lives.
Isn't that a conflict with the party that's in charge here, that they've done so much for health care? What kind of bills are they presenting right now to either help you or go against you?
Well, I think the Florida legislature continues to play this role of restricting access to care rather than expanding it, and we saw that during last session with the lack of Medicaid expansion. Now, there were attempts to compromise, but at this point, there is no solution. LIP funding for the low-income pool, which is charity funding for hospitals that often are catching these folks in the cracks, will not increase based on the federal government today anyways. And so when it comes to the trend is that we have 3 special sessions, and it continues to be a very tiring experience for Floridians across the state. Now, we are facing 3 pieces of legislation ourselves that are designed to restrict access to safe and legal abortion. And that's 2 in the House and 1 in the Senate, and we do expect there to be more as well.
How's that look? If they're successful, how badly are you hurt?
So these are bills that are designed to target abortion providers, and they're not original. We've seen them across the country. So this is Texas-style legislation. So one of them is the requirement for a doctor who provides abortion access to have admitting privileges, which is medically unnecessary. Abortion is one of the safest medical procedures in the country. The CDC grants abortion 99% safety record. And the other dynamic is the requirement for unnecessary building restrictions. It would require any facility who is an abortion provider to be an ambulatory surgical center standards. And I want to elevate too in this conversation is that right now in the state of Florida, there are 66 abortion providers or physical abortion clinics. 16 are Planned Parenthood clinics, and so and we do not provide abortion all of our service at all of our sites, and we don't provide them every day either. And so when it comes to this conversation of abortion access, Planned Parenthood's priority is to provide a full range of healthcare services, no matter what.
Real quick, give us how do we contact you?
You can check out our website. It is ppswcf.org.
I'm Jose Miranda. This has been Hispanic Speak Out TV. We'll see you again next week, same time, same station.